All right, hopefully you are back. We are going to look at the lower appendages. Okay, I'm just going to kind of go down there. Much bigger femur. Trying to give some perspective here. You can see the femur is obviously a heck of a lot bigger than the tibia. Okay, so for some reason, sometimes people confuse these when they're holding them and looking at them. Sometimes people confuse the foot for the hand, so I don't know, but just want to let you kind of see here the size of this thing. All right, here is the top. Here's the superior aspect of it. It has this big old head of the femur right here that sits in your acetabulum, your hip socket. Okay, but that's this right here. Okay, that's the femur. This again, the tibia, your shin bone. Okay, that's where your knee is. Got this tiny little sliver of bone. Okay. Fibula. Really weak. The foot. And the first thing we got here is your hip. Okay. The way to orientate the hip is really one major thing. Okay. Well, two major things, I guess. One, this right here, I want to make sure it's number one there. Yeah, is the acetabulum, right? This is that little hole where that femur head sits. Okay. That points laterally, all right? Because your leg's lateral, all right? Legs lateral to the hip. So that's got to point out. It's got to point lateral. The other thing is this big roughened little bump right here, all right? When someone says you have a bony butt, this is what they're talking about, all right? And I want to make sure. Right there. Okay, ischium and ishiotuberosity, all right? That's that big bump right there. This whole, I'm going to grab it with my hand, all right? This part right here that I'm grabbing with my hand, this is the ischium. This is the ishiotuberosity here on the backside. On the front, this is your pubic bone. Okay, so all that stuff I'm grabbing right there, that's the pubic bone. All right. So I got the ischium in the back, the pubis in the front, and then the rest of it all up here, this is the ilium. All right. All of this right here is the ilium. So when someone says your hip bone, what are they talking about? Okay, because the hip bone is really termed the os coxa, O-S-C-O-X-A. And the os coxa is your hip bone. And the hip is the fusion of these three bones, the ilium, the ischium, and the pubis. Okay, pubis is in the front, ischium is in the back, ilium is the big superior aspect of it. All right, so there's ilium, I just kind of showed, ischium, ishiotuberosity, and pubis. All right, so ischium, pubis, and ilium are the three bones that make up the hip. Again, the acetabulum is this little hole right here, this little depression. It's where the head of the femur sits. You can see here we have A. I'm going to show you A and P here. Here's the anterior superior iliac spine, the anterior inferior iliac spine. If I go over here to the third column, your posterior superior iliac spine and your posterior inferior iliac spine. So you got to know front from back, okay? So I'm going to orientate it like this for you, okay? Because this is going to be the back side, and this is going to be the front side, okay? So here's the two bumps in the front. Anterior superior iliac spine, anterior inferior iliac spine, okay? Anterior because it's towards the front, Okay, there's my pubic bone. So towards the front. Okay. Superior, because it's above. Inferior, because it's below. Okay. Anterior, superior iliac spine, anterior, inferior iliac spine. I go over here to the backside. Okay. I go over here to the, I don't know why these stupid things keep popping up. Okay. Yes, I know, I'm using it. Okay. Okay. All right, so right here. Right here was the front. Now I'm in the back. Okay. You can see there it is, and there it is. Here is my posterior superior iliac spine and my posterior inferior iliac spine. All right. These are going to be things, these are going to be things that muscles will attach to, origins, insertions. All right. That's why we're going over all these nuances, because you're going to be going over origins, insertions, and having to name some of them for me. All right. All of this right here, this is your iliac crest. Okay. First column, second from the bottom. Okay. So when you put your hands on your hips, this is what you're putting your hands on your hips on. Okay. You put them on that iliac crest. And if you can palpate it, if your hand's big enough, okay, if you put your entire hand on that crest, all right, you should be able to, and I can feel it on mine, you can feel your anterior superior iliac spine, the iliac crest, and the posterior superior iliac spine, all by just kind of palpating your hip, the arch of your hip there. So you can palpate and feel all those on a person easily. We have two little notches. Okay, I'm gonna go right, try to get a nice little side angle right there. Okay, we have a big one. That's your greater sciatic notch. And right underneath this structure here, which I don't think I have, no, is the lesser sciatic notch. Okay, greater sciatic notch, lesser sciatic notch. Sciatic nerve travels right through there. Okay. So we have greater sciatic notch, lesser sciatic notch right there. It's the middle column. If I stay in this middle column and just go down, okay, there's the obturator foramen. Okay, there's the obturator foramen. Obturator nerve goes through it. Obturator internus, obturator externus are two muscles. They cover it. So obturator foramen. One more. Oh, yeah. Okay. Lateral. Okay. Medial. See this nice little smooth area right here? That's the iliac fossa. Okay. And a muscle sits there called the iliacus muscle. So that is your hip. Very straightforward.
Do you have two of those to show us how they would sit?
I don't. I don't have one. When I go to the campus next week, I'll try to get one to kind of show you what it looks like. But I don't have the paired. I apologize. Femur, 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 femur. Okay. Superior, inferior. Okay. This articulates down here with the tibia. Okay. And forms your knee joint. All right. Up here, this articulates with the acetabulum, forming the hip joint. Okay. So we have first column, head of the femur right here. Okay. This big bulbous structure right there. Easy. I have a big protuberance of bone that you can see all right here. Okay, I'll kind of turn it this way so you can kind of really see it now. This big, huge projection of bone is called the greater trochanter, just a roughened projection of bone. Okay. Middle column, lesser trochanter. Head of the femur, greater trochanter, lesser trochanter. You see this spot right here that where it kind of narrows and constricts? So you have your bulbous head, where it constricts is the neck. And that is the third column right there, neck of the femur. So I've got the head, I've got the neck, I've got the greater trochanter, and I've got the lesser trochanter. We have two structures within kind of this part here of the bone, okay? So here's kind of the superior stuff that we just kind of pointed out. Now I have all of this part here. I'm gonna try to back up, okay? So now I'm kind of in between my two arms here. Right? That's the area that we're talking about. Not down here, not up here, kind of in the middle. This whole long shaft of bone, shaft of the femur. Pretty obvious, okay? You know, you can't really see it, but you're looking at the anterior aspect, okay? For the shaft of the femur. Third column, last thing checked. At least it is on mine. I don't know what it is on yours. Okay? I'm going to go over here to this middle column right here where it says linea aspera. Linea aspera is on the posterior side, right? You can kind of see it as I turn there. You can see there's that ridge of bone, okay? There you go. I mean, you can kind of see that ridge right there of bone. It's right there. This runs along the posterior aspect of the shaft of the femur, right? So if I'm asking for the shaft of the femur, I have a picture of the front side. If I'm asking for the linea aspera of the femur, as I get closer right there, you can really see that ridge right there. There it is. Okay? There's that ridge right there. And it's just, linea means line, aspera is just a line ridge on the back of the femur. It's where your hamstring muscles, some of them will attach into the structure. Again, that's why we have that little kind of cresting up of bone. It's there for one purpose, and that's for muscle attachments. All of these weird, funky protuberances, okay? They're all there for one thing, and that's for muscle attachments. So if we continue down, okay, you're looking at the anterior surface, okay? This is the inferior aspect. See that smooth area right there? This is your, right there. This is your patellar surface. It's where the patella sits. Where's the patella? Where is, did I get the patella? There's your patella, okay? And it just sits right there and just glides, okay? If all that's rough right there, then that's arthritis, arthritic changes, and that's chondromalacia patellae. And that's not fun if you have it. To diagnose it, you got to mash the patella into it too. It's really painful for the patient. But orthopedic tests are designed to be painful. All right, so now I have all these structures kind of right here that I'm gripping and holding on. All right. I have two smooth surfaces right there that you can see. Right there's my patellar surface. So these are right here on either side. Okay. These smooth surfaces are, again, that points medial. My medial condyle of the femur, because you're going to have one of the tibia. Okay. So there's your medial condyle of the tibia. And then there's your lateral condyle of the tibia. Again, it's just a smooth surface. That's all it is. Okay, right there, medial, lateral. Okay, medial, lateral. Just above the two condylar surfaces, okay, I have these two kind of bumps that stick out on the side. These are above. Epi is above. Okay, so I have my medial epicondyle of the femur, and I have my lateral epicondyle of the femur. Okay, it's just this little bump out of bone right there. Okay, ligamentous attachment, muscle attachments, that's what these are for. Okay. If I continue down, okay, now we have, now we have the tibia. Okay, kind of what it looks like. Looks like that weird Star Wars character in the cantina. Right? Like, oh, of course. Okay. Here is the tibia. Here is the inferior aspect. Okay. Let's see here. Let me shrink this up. I'm going to start with the condylar surfaces here. Okay. The medial and lateral condyle. Okay. Condylar surfaces are smooth. Okay. Condylar surfaces are smooth. So here are my two condylar surfaces here on the tibia. Okay. This is going to be right here. Can't see it. This little thing right here is the medial malleolus. Guess which way it points? Medial. Okay. So if I follow that up, then there is my medial condyle of the tibia. Lateral condyle of the tibia. Okay. In between, you have this little crest. If I pull it there, there you go. You can kind of see it right there. This little bump. Okay. Looks like two little mountains kind of coming up right there. Right there. That is the intercondylar eminence. Okay. Intercondylar eminence. First column. The last thing that we have up here, okay, is this little bump of bone right there. You can really see it when I put it to the side. That is the tibial tuberosity, okay? If you just palpate right below your knee, okay, it's that bump right on the anterior surface when you get on your tibia, all right? If you have Osgood-Schlatter's, okay, as a child, it's because you have too much force being generated by the quadriceps muscles collectively, and they are pulling on that patellar tendon, the patellar ligament, okay? And the body responds by laying down a bunch of bone right there where that patella ligament attaches into, okay? And it lays down all this extra bone, so you have a huge bump on the front of your tibia there, and it can be painful for those children until they kind of grow up and grow into the bones, okay? And then obviously I said it earlier, but there's your medial malleolus, okay? When you look down at your ankle, it's that bump right above the ankle there. The fibula is boring, okay? Here's the fibula. I mean, you can see in comparison to the tibia, it's not very spectacular, okay? But here's how it articulates with it. So it's not really technically part of the knee per se, because it articulates on the underside here of the knee, okay? Underneath that condylar surface there on the lateral aspect. And then here you can kind of see how it fits down here. There we go. Okay. So if I just look at this thing, all of it's the fibula, okay? This little bump of bone here is the lateral malleolus. It's that bump on the outside of the ankle there. And then where's the head? The opposite end, right there, okay? Head of fibula, lateral malleolus. That's it. Lastly, we have the foot, and really all of those things that are open there are all like on this thing right here. It's pretty easy. We have calcaneus and talus. They are the kind of the two big bones of the quote unquote foot. Calcaneus is your heel. Here it is right here. Okay. It is your heel. There's all the foot in all of its glory. Okay. And your heel is right here. It looks like a can. Calcaneus, calcaneus. Okay, Josh. Okay. Sitting right on top of the calcaneus is this little bone right here. Think of it like the talons of a bird sitting on a wire. That's how it gets this name. So here, right here is the talus. The talus articulates with the tibia and the fibula a little bit up above it and the calcaneus below it. All right, so this right here, I'm not going to ask it to you disarticulated, but that's it right there up top. Calcaneus is your heel. Okay. Big toe. Okay, it's big, right? It's also medial. Okay. So I'm just giving you a point of reference here. So I've got 1, 2, 3 little bones right there. Okay, 1, 2, 3. This is the medial cuneiform. Immediately, well, just immediately in this view right here, immediately inferior, okay, to the big toe. Here's the big toe. So there is your medial cuneiform. Okay, it's behind the first metatarsal. Right next to it, right there, that is the intermediate cuneiform. And then right here, that is your lateral cuneiform. Medial, intermediate, and lateral cuneiform. Medial, intermediate, and lateral cuneiforms. We've got 2 other bones right here and right here. Okay. This one right here, most medial, it's navicular. N is close to M in the alphabet. So that's how I always remembered that one in the beginning. Navicular is more medial. Cuboid, see you later. CU of cuboid, CU later, L for later, L of lateral. Okay. So if I hold it here, where the big toe, doesn't matter how I hold it, there's navicular. Sorry, there's navicular. Okay. Pinky toe is always lateral. There's the cuboid. And it's shaped like a cube. Medial, intermediate, and lateral cuneiforms. All of those are your tarsal bones, okay? There are all of these bones right here, okay? Then I have these bones in the middle. All of these are your metatarsals. Start with your big toe. Metatarsal 1, metatarsal 2, metatarsal 3, metatarsal 4, metatarsal 5, okay? As long as you can count 1 through 5, and as long as you know big toe is medial, that's where you start. 1, 2, 3, 4, 5. The last thing we have are the phalanges, and the phalanges are just digits. That's all it is. You have phalanges in your hand. You have phalanges in your foot. Okay. So that's why they put digit 1 of foot, digit 2 of foot, okay? This whole thing is digit 1. This whole thing is digit 2. That whole thing is digit 3, digit 4, and digit 5, little pinky toe, okay? Digit 1, 2, 3, 4, 5. Easy. The thing that is even easier than that, when you look at these digits, okay, you see that they bend. And I'm going to use my hand, okay? This is like my big toe, okay? This right here I'm showing you is my digit. And when it bends, there's only one joint, okay? And you see two bones. If I go here and bend, okay, now you see two bends, two joints, three bones. When we look at digit 1, your big toe, it has a distal phalanx and a proximal phalanx. Okay, so distal phalanx of phalange 1, proximal phalanx of phalange 1, or digit 1. I don't care either way. Okay. If I look at toe 2, 3, 4, and 5, they have 3 parts, right? Okay, so I got 2 bends in all those guys. So I have 3 bones. Okay, a distal phalanx, a middle phalanx, and a proximal phalanx. Distal, middle, proximal, distal, middle, proximal, distal, middle, tiny nub, proximal. Okay. The one thing that people forget when it comes to the metatarsals or the metacarpals or the phalanges, okay, the phalanxes, is numbers. Same thing when it comes for the ribs, because we have 12 ribs. Okay. And sometimes I ask, well, that's more a lecture, but the number of vertebrae, all right? But when it comes in the lab for identifying ribs, you should be able to easily identify rib 1 through 12, okay? And we'll go over how we identify those. Okay, they either directly connect to the sternum, or they don't directly connect, or they float. So it's pretty easy how we name those. Okay. But one of the biggest things that people forget and lose easy points on this lab exam is forgetting the number of the digit. Okay. Or just simply forgetting to put of the bone that it's on. All right. The test is pretty straightforward. Okay. It's always going to ask for the structure and the bone.